Welcome back to the podcast. I'm your host, Samara. Today, we are diving into one of the most difficult and misunderstood topics in the mental health community. It's the elephant in the room. Why do so many people with bipolar disorder stop taking their medication? It's a question that families, doctors, and patients struggle with every day. To help us unpack the why behind this, we have our resident expert and author, Dr. Laura. Welcome back to the show, Laura.
Thank you, Samara. It's so important that we talk about this without judgment. When someone stops their meds, it's rarely out of rebellion. Usually, there are very deep, logical, though often painful reasons behind it.
Exactly. And I know on your site, bipolar-lives.com, you've listed several triggers for stopping medication. Let's start with the most common one, feeling cured. Why is that so dangerous?
It's the great paradox of bipolar treatment. The medication works so well that the person starts to feel normal again. They think, I feel great. I clearly don't need this stuff anymore. But as Dr. Laura, I always remind my readers, you feel great because the medication is providing that floor of stability. Taking the floor away doesn't mean you'll keep standing. It usually means a fall is coming.
It's like stopping your umbrella because you aren't getting wet in the middle of a storm.
That is a perfect analogy, Samara.
But then there's the other side, the side effects. We aren't just talking about a dry mouth. We're talking about weight gain, brain fog, and feeling like a zombie.
That is a huge factor. Many patients feel they have to choose between their sanity and their identity. If the meds make you feel flat, like you've lost your creativity or your spark, it's incredibly tempting to quit. In my work as Dr. Laura, I advocate for a middle ground. You shouldn't have to settle for being a zombie. It's about working with your doctor to fine-tune the dosage, not just quitting cold turkey.
You also mentioned something in your article that I found fascinating, missing the highs. Can we talk about that?
Yes. Hypomania can feel like a superpower. You're productive, you're charming, you're energetic. When medication levels that out, life can feel, well, boring. Some people stop their meds because they are grieving the loss of that high energy. They miss the magic, even if that magic eventually leads to a crash.
It sounds like a grieving process, honestly. Losing a part of yourself to gain stability.
It is. And that's why support is so vital. If we don't acknowledge the loss of the highs, the person will keep chasing them. We have to show that a stable life, a bipolar lives life, is actually more rewarding in the long run than the chaotic peaks and valleys.
For someone listening right now who is tempted to throw their pill bottle away, what's your advice?
Please, don't do it alone. If you hate how you feel, talk to your provider. There are so many different combinations of treatments today. The goal isn't just to not be manic. The goal is for you to thrive. Don't quit the journey just because you hit a bump in the road.
Such powerful words. Dr. Laura, thank you for always bringing so much heart to the science of this disorder.
Thank you, Samara. My door is always open at Bipolar Lives for anyone looking for answers.
Thank you all for joining us for another deep dive. If this conversation resonated with you, please like this video and subscribe to our channel. Your support helps us reach people who might be struggling in silence. Check out the full article and more resources at Bipolar Lives. Until next time, stay safe and stay balanced.